Hi, my name is Ben Quayle, and I'm going to be doing a presentation on social media and HIPAA violations. The case that I'm going to be talking about happened in February of 2009 in Wisconsin at a hospital called Mercy Walworth Medical Center. In this case, two nurses end up getting fired for taking pictures of a patient's x-ray. The patient came into the ER one night and had a device lodged in his rectum, and the two nurses took pictures of the x-ray and then later posted them onto Facebook. A few weeks later, an anonymous source informed the police that these two nurses had posted these pictures on Facebook. And when the police began investigating it, they determined that what the nurses actually didn't actually violate any Wisconsin laws. But it did, however, violate federal laws, in their opinion, so they escalated the case up to the FBI. The two nurses were suspended initially while the hospital did its investigation, and later the hospital determined that they violated company policy, so they were fired. The hospital claims that it regularly educates their employees about HIPAA violation, and yet the nurses disregarded this education. The nurses stated that they didn't actually have any of the patient identifiers on the picture. You can see in my PowerPoint that I put up a picture there. I don't know if this was declassified or not, but there is no patient identifiers. That is not the actual picture, though, for this case. And the reason I bring up that the nurses stated that they didn't have any patient identifiers is because HIPAA has a de-identification process, and they violated this. So we all kind of generally know that you're not supposed to talk about patient information. You're not supposed to post that. You're not supposed to go around talking about patients because it could be a HIPAA violation. But there are ways to de-identify pictures, and even though they said, oh, it didn't have any names on it, you actually have to go through a process with expert determination or safe harbor. These two types of ways require a lot of paperwork. It either has an expert saying, all the identifiers have been removed, or you can go the safe harbor method where you have to remove 18 types of identifiers, such as social security numbers, birthdays, patient names, MRNs, etc. Seriously doubt that either of these nurses actually did any of that. Also in the article I read, they interviewed a couple of lawyers about the incident, and they had a couple of things to say that I thought were kind of interesting. One was that these types of cases are typically reported to the board of nursing after they happen. So these nurses, even though that they were let go from this hospital, are probably going to have a tough time finding jobs elsewhere because they've been reported to the board of nursing. And the article is a little older. It happened in 2009, and at that point they said between 2003 and 2009 over 40,000 HIPAA violations had been reported. So it kind of aligns with when social media really took off, that this huge jump in HIPAA violations was reported. And the lawyers also say that hospitals must properly train employees about HIPAA in order to protect themselves. So the hospital was, they didn't have any repercussions for what these nurses did. It was pretty much all on them at that point. And another thing that the lawyer says is that hospitals really need to scan for online usage and etiquette when hiring people, because you can kind of look into someone's past and see if they might be more apt to actually, post things like this. And as far as HIPAA social media rules go, HIPAA was introduced in 1996, and social media really didn't start to take off until the mid-2000s. So there are no specific HIPAA social media rules. HIPAA does state that you cannot disclose patient health information or, take pictures, but they really probably didn't see this coming, where every single person is going to be walking around with a camera on them at all times. And you're not allowed to openly discuss a patient, even if a patient is not named specifically. So it can kind of be interpreted that social media is almost like a forum, going down to a city hall and talking about, Bob Smith's medical records. It's kind of the same as just posting it out there in the public. A couple of things that I think that could help fix the problem with HIPAA and social media and things like that is just to maybe update the HIPAA laws to incorporate the use of social media. Not having anything in there right now could potentially put a lot of gray areas, and I've been thinking about it, and I kind of compare it to the First Amendment. When that was written, at that point you just had like newspapers and books, and people could just talk in a town hall. I mean, they didn't anticipate that freedom of speech would umbrella things like the internet and telephones and all of that stuff. So it's HIPAA does work right now, and it can prevent people from using social media, but it doesn't have any specific rules in there. And I also think that it's really important to properly educate your staff about social media usage. I know my hospital does it right now. But it's just really important to keep pressing that on people. And I also think there should be clearer punishments for offenders, because right now it just says you could face jail time, there could be a fine, no one really knows who's to blame. If you incorporate social media rules into HIPAA, I believe it could, it could definitely help with this ongoing problem that we have. All right. I included my references in the PowerPoint, and thank you.